Hey everybody, Nurse David, your safety influencer. Welcome back to the channel. Thank you again for joining me. This topic is one that is extremely important to me, and I have a good feeling that I'm going to be doing more than one video on this subject because it is really important when it comes to just really keeping your elderly safe in their homes. It's such an important area as a home nurse. It's one of the areas that I'm always focusing on more than anything else because this is where errors can happen. This is where health issues come up. Just really important to focus on this. And we're talking about, of course, medication safety. As a home nurse, one of my responsibility has been to assist seniors with the proper and safe management of their medications. There's a lot of data out there in regards to safety when it comes to medications and the elderly. The risk of hospitalization due to adverse medicine outcomes in the elderly is almost 6 times greater than the general population. So it's really important to understand that, when you're dealing with your parents, your grandparents who might be, they're seniors, they're getting up there in age, and that they're taking medications, really important to find a way to connect with them, to discuss this topic with them, to make sure that what they're doing, what they're taking is safe and makes sense. So what are some of the top issues when it comes to elderly with their medications? Well, one of the things is they don't take them as they're prescribed, or they just simply forget to take them. Sometimes they aren't managing their pills properly. Sometimes they take medications that are already expired. They are sometimes taking too many medications. Or sometimes they stop taking medications because they feel so good, or because they don't feel good at all. So let's break down these issues and see if we can't help our elderly loved ones to find a way to get better compliance and better health outcomes. First of all, they forget. If your loved ones are showing any signs of short-term memory loss, yet they are still 100% in charge of their medications, this is a reason for you to be concerned. Most older adults are taking all or some combination of medications such as a statin for their cholesterol, some type of blood pressure medication, whether it's for hypertension or hypotension. Most older adults are taking an antibiotic for chronic infections. They may be taking a blood thinner, such as something as simple as a baby aspirin or even Eliquis or Coumadin, which are prescribed by a doctor. They may be on diabetic medications. So it's important to understand that if your loved ones are taking any of these medications and they're not taking them properly and they miss them, it can really affect their health negatively. So if you suspect that they are missing any of these meds, there's a few things that you can do. One of the ways you can help them is to ask them about their daily routine when it comes to the medications. When I meet a patient for the first time in their home, one of the first things I'll do, if I suspect that there may be a little bit of memory issue, they may be somewhat forgetful, I will say something like, Mrs. Jones, why don't you go grab your pills for me? Let's sit down and go over all of them together. And then one by one, I'll ask her to describe to me the name of that medication and what it's used for. Does she know? Is she taking it as the prescription label shows? Ask questions, okay? And you can do this with your loved ones. It helps you to get a better understanding of what they're taking as well. If they can't answer any of these questions, you should intervene and assist them with managing their medications so that they are compliant. Another very important tip to make sure that your loved one's being compliant with their medications is do a pill count. Okay, all the prescription bottles simply have the date that the prescription was filled right there on it. Okay, so look for that filled date on the bottle. Wash your hands, take a paper towel, pour those pills out. Now, if they were filled 30 pills on the 14th of this month, and then you see that there are 10 left, do the math. And if they were supposed to take 1 per day, it's simple enough, but make sure by doing that pill count, you can see if mom or dad or grandma or grandpa have been taking their pills as prescribed. Sometimes they forget to take their medications, and sometimes they take too many, okay? So same thing goes if they pre-pour their medications into a tray. Do the count. Compare the prescription total pills versus what's left in the bottle versus what's left in the tray. If the numbers are off, again, reason for concern, reason for you to intervene, to help them to have optimal health and be compliant. Again, read the bottle. If the prescription for a medication is for twice a day, many times older adults do not take the prescriptions as they are written because they're trying to cut down the costs. As you're well aware, you've seen this on the news plenty of times, prescription prices are through the roof on a lot of medications, and let's face it, a lot of our older adults do not have tons of money for this. And a lot of times they will try to justify not taking their medications because they can't afford them. If you're seeing that that's a reason why the pill count number is off, explain the importance, but then also talk to the prescribing doctor. See if there is a generic. See if there is an alternative to the medication that they're taking, and explain to the doctor they're not being compliant because it is very costly. What can we do to change this? An example of this is blood thinners. If you were to look up Eliquis, which is very common, versus Coumadin, they are miles apart in the cost of each other. Obviously, there's a lot more differences in there besides the money. But again, I'm just trying to explain to you the fact that there are alternatives out there. So if this is one reason why your loved one is not taking their medication, it's because of cost. Definitely speak to the primary care physician that has prescribed that medication and see if there's an alternative. In addition to that, you can use apps like GoodRx. I've used this app for my own medications, and let me tell you, it has been a lifesaver. It absolutely has saved me a lot of money. It's an app that does not ask for all of your pertinent information, your firstborn and your blood type. You have to put very little information in there, and then it shows you which pharmacy has the cheapest price for that medication. Of course, you like to use the same pharmacy for all your medications, but almost all pharmacies now are familiar with these apps like GoodRx, and they will honor the price. Next, you need to ask your loved one, where are their medications? They should not be some in the bathroom, some are in the bedroom, some are in the kitchen cupboard. Centralize and organize. If pills are in 5 different rooms, trust me, your loved one is not running to 5 different rooms all these different times of the day to take their medications. Get them in one central area. Finally, to this point, set reminder alarms on their personal cell phone if they happen to have a smartphone. You can also purchase these types of medication alarms online. I've seen them for as cheap as $10. Just little alarm boxes that are specifically used to go off 2, 3, 4, 5 times a day, however many times you need to program it, to remind your loved one to take their pills. Next, they aren't managing their refills. As we just discussed, one of the reasons they don't manage their refills is because of cost. They're afraid that they can't afford it. And as I said before, please find the name of the doctor on the bottle, discuss this with your loved one, call that doctor and see if there are cheaper alternatives to that drug, or see if you can do that through the pharmacy. Most pharmacists can do this for you. Lastly, many medications can be filled more than once a month, except for narcotics. So ask the pharmacy. Sometimes they're eligible for auto delivery. Something called Express Scripts is a company that I've seen used by many of my patients in their home. Express Scripts, if it accepts the insurance, can also, again, send a medication 3 months at a time. So the time in between is lessened. There's more pills in the home to fill more trays and to make sure that there is compliance and that we don't miss refilling a prescription. So there's a couple options out there. Work with your pharmacy, work with your doctor to see if any of these are possible. And of course, work with your insurance. Next, they're taking expired medications. This happens a lot more than you might think, especially with over-the-counter medications like pain relievers or supplements, vitamin D, vitamin C, zinc. Please check the bottles, check the expiration date. And this is also a really good reason to remind your loved ones, never combine pills into a bottle. When they have one prescription for, say, their statin, they have last month's has a few pills left and then they get the refill. Never pour the existing refill into the new bottle. You don't want to mix pills. They shouldn't expire within such a short amount of time, but again, you just don't know. So it's always important. Whatever the quantity of the pills were in one bottle, keep them there. Don't combine pills into one bottle just to save space. It doesn't make any sense. So for any of your medications that are expired, what you can do, there's a few ways to get rid of them. Number one is to take them to your local pharmacy. A lot of the pharmacies do have locked units where you can actually just drop it off yourself, or you can go right up to the counter and just say, these are expired, or I don't need these anymore. Please dispose of these for me. Remember, please never, ever, ever, ever flush your medications down the toilet, okay? Not safe for the water system at all. If you want to, what you could do is put the pills, mix them in with something like nasty old food that you're about to throw away. Coffee grounds is another one because it, mixes in and also helps to dissolve them. Dirt or cat litter, okay? And then what you'll do is put it in a sealed bag to prevent it from leaking into the garbage. And then throw that away. Or there are sites like from the EPA website, which I'm going to put below. So there are a few ways to get rid of expired medications. Don't just take them and throw them in the trash. Keep in mind also, please take the labels off, okay, or at least try to scratch out the name. Just protects your loved one's information. They are taking too many pills. Like many of us, they can become overwhelmed if they're taking too many pills. This is the time to take note of the prescribing doctor because, again, remember, a cardiologist is going to prescribe the heart medications, okay, and then they may be seeing other specialists. So you're going to want to note the medication and the prescribing doctor. And then together with your loved one, you can sit down, call the doctor, okay, and see if any of these medications are still 100% necessary. Remember, a lot of older adults don't see their doctors every single year regularly, okay? And so they may be just on this auto refill for certain medications and, well, I've been taking it, so be it. It's really important on a regular basis, especially as an older adult, to be getting blood work, to be seeing your doctor, to get a checkup and to see if anything's changed so that they can see your existing list of prescribed medications and then see if something needs to be adjusted. But in this case, if they're taking so many medications, it's really important. If you see it's like, oh my God, mom's taking, 20, 30 pills a day. Now, again, these may be important. There may be like no option. This might be the only thing that she can do. So be it. But often you'll see that things such as supplements can be cut down or even eliminated with, again, the doctor's approval. Don't just do this on your own. Speak to the primary care physician, or again, if there's a major doctor like a cardiologist who's handling most of the medications, speak to them. And speaking of having multiple doctors and multiple medications, this is a time when you sit down with your loved one and you create a complete list of everything that they're taking to see if any of these medications are what we call contraindicated, meaning do they not mix well with other medications, okay? As I said before, a lot of times our loved ones do have multiple doctors or specialists for different areas of their life, and they are all prescribing medications. It is imperative that a complete list of these medications is reviewed by each MD every time that they see them, and especially the primary care physician. It's just to be certain that there are no adverse reactions by combining certain medications. You can also research this yourself at drugs.com. They have literally what's called a drug interactions checker. Simple enough. So when our loved ones are taking multiple medications, this is also a really good time to discuss the idea of pre-pouring their medications into weekly trays. And I'm sure you've seen these at your local pharmacy. They come in a variety of types that can give you 2, 3, 4 times a day, and they're usually 7 days a week. When there are so many medications for them to remember, it can be extremely challenging for them. And all of those bottles, some of them are nearly impossible to open. Pre-pouring medications into the tray once a week can help them to increase their compliance. It's also, again, the perfect time to discuss with your loved one, how are they feeling? Use that time to be involved in their health and let them know how much you care. They stop because they don't feel good or they feel way too good. So sometimes seniors think that they can stop taking their medications because they're feeling better. And that's the time to remind them that it's the medication that is working and making them feel better. A common one with this is anytime they're prescribed an antibiotic, and a very common infection or a reason for an antibiotic with an elderly a person that you've seen me talk about in other videos is UTIs, urinary tract infections. And often the doctor is going to prescribe, say, like a 7-day course of an antibiotic. And then you're supposed to take all 7 days. Just after 3 days, if you're like, oh, everything's cleared up and I feel better. No, you don't not take the last 4 days. You have to take the medications as prescribed. Same thing with heart medications. It's the reason your blood pressure feels good. It's the reason that your heart's beating normally. These medications are there to regulate, to make sure that you are living your optimal health. So because you're feeling super good, that's because the medications are working. Don't stop taking them. But on the flip side, when our loved ones are really not feeling well, and we know what that's like, with the elderly, just in general, there can be such a decrease in appetite in general, even when you're feeling your best. As we age, we lose sensation of taste and so forth, so we don't eat as much. And then especially when you get sick as an elderly person, then you really start to lose your appetite. So if you're not even wanting to put food or drink in your body, one of the last things you might be thinking about is like, well, I don't want to take my pills either. That's the time when they're not feeling well to remind them they have to take their medication. Again, unless a doctor has told them at a particular time to stop something because they're going through a particular illness. But if their doctor has not said to stop taking their medications, they need to keep taking them. So encourage them. And while we are talking about medications with the elderly, this is a really good time also to note if your older adult is taking what we call anticholinergic medications. These are sedatives. These are nighttime over-the-counter pain relievers. Drugs for overactive bladder, for vertigo, nerve pain medications. These can adversely affect safety in the elderly, okay? It definitely affects their level of alertness and their strength. So if they are on any of these medications, and in your research, you're going to notice that name. I'll put it down here again for you. And these are the ones that you want to really look out for. If you know that your loved one is taking one of these types of medications, please, please, please be aware of that and note the times that they take it, how often they do, because again, this can really affect their safety. And I think it's really important for you to be aware of that. Along the same lines with over-the-counter medications, please note that if your loved ones are taking anything like Aleve, Advil, Motrin, because these can, believe it or not, with other medications, even on their own, increase your blood pressure. They can cause stomach ulcers. They can affect the kidneys. So if they are taking those, check on that and confer with their primary care physician to make sure that it's okay and safe for them to continue to do so. And remember, medications are metabolized differently in the elderly than people that are 20, 30, 40 years younger. So never compare, well, I take that and I feel fine, with someone who is older than you. The reactions are completely different. So how do we create compliance with medications with the elderly? So there are a couple of simple steps that you can take. Okay, first of all, do your homework. As I said before, create a list, sit down with them, create a complete list of their medications, know the side effects, and also explain the importance of these medications to your loved one. Make sure that they understand why they're taking them. As before, ask their primary doctor if any of these medications can be either eliminated or reduced. Again, supplements are often not as necessary. If your loved one is still confused, get the doctor that prescribed it involved. Get them to explain this medication to your loved one. It may sound strange, but with the elderly, sometimes a reason that they don't take their medication is they're difficult to swallow. Remember, please, as we get older, things do not work the same way that they used to, including your ability to swallow foods and pills and so forth. So unless there is a reason, according to the doctor, that you can't do this, don't forget that pills can often be taken down with a little bit of applesauce, pudding, a little bit of ice cream. But please, this is really, really important. If you're ever going to use something like a pudding or an applesauce to put some pills in to give to your loved one, never put 3 pills in a cup of applesauce, because then you have to finish the whole cup of applesauce. So remember, if you're going to do this, do it tablespoon by tablespoon, okay? Even if you have to remind them to do it pill by pill. Never mix pills into a large amount of any type of mixture that you're now telling your loved one, you need to finish that entire cup of ice cream or that entire cup of pudding, because then they're not going to, most likely. And then they're not going to be taking all of their medications. So if you're going to use something like that to help them to get the pills to go down a little smoother, use just as much as you need for that amount of pills. Lastly, and one of the ways for compliance that I am a huge advocate for, pill trays. If you can assist your loved one in using a weekly or 2 weeks for a weekly tray to put their pills into, you really increase their compliance with taking their medications as prescribed. And as I said before, if you can get them to let you help them out, it's a perfect time for you to be sitting down. Sure, talk about the weather and other things, but it's a great time to just use that time to talk to your loved one. How are you feeling? What's going on with you? How do you feel about these medications? Are they working? Do you feel differently? Do you feel better? Do you feel off? Use that time to get that information from them so that you can help them. Again, these medications are prescribed because they're serving a purpose. Taking them helps that purpose to be lived. So if they're not taking them, anything that you can do to create that compliance for your loved one, it's all the better for their health. Again, I know this was a lot of info. I really do hope that you found it helpful. This is a subject that's really near and dear to my heart as a home nurse. I'm sure, like I said before, I'll be making more videos than just this one in regards to medication compliance and safety as time goes on. As always, if you have any questions, any comments, please leave them below. I will do my best to get back to you as quickly as I can. Please like and subscribe to this channel. I will be posting a lot more videos. Also, if there's a topic that you want me to address, put that down below as well. I'll do everything in my power to get to that topic as quickly as possible. Stay safe. Stay well.